I think
Can you hear me? Can you hear me?
maybe in the bottom, on the bottom right, there is a little icon for a microphone.
Um, well, I don't know. I thought I made it maximum.
That's oh well. So are you at your office or where?
Yes, yes, I am at my office.
Okay, that's good. Maybe if I can put a uh, here an earphone, maybe I can hear it better. Let's see.
So,
I'm trying
uh,
to. Yeah. So anyway, I will be coming on Wednesday morning, early morning.
okay.
So hopefully I'll see you sometime later. Let
Yes, yes. Wednesday we'll meet. I haven't done an
me
agenda.
see.
On Thursday is the thing. On Thursday
Yeah,
is the
yeah.
round.
Thursday is we yeah. So I'll arrive Wednesday early morning, and I have all Wednesday, and as to relax. I mean, recuperating because the trip is too long,
Yes.
and then I'll be there Thursday and Friday, and then leave Friday night.
Okay. Okay.
Yeah,
Nice. I'm glad you're coming.
yeah, exactly. I'm looking forward. Tell me, do you need anything from here?
Well, I don't know. Maybe.
Maybe
I
send me
always
send me
know
what you need. I'll get it.
books are the best thing.
Okay, okay, that's fine. Just send it to me, and I'll bring it back with me.
Oh, okay, that's a good idea. Maybe I can order something for my card and send
Yeah,
it to you.
why not?
What
Why not?
uh, which address should I use?
The best address is to my home is
Can you maybe
or
email?
I'll send it to you by I'll send it to you by WhatsApp.
Okay,
Okay?
great. Thanks. So
Yeah, I'll do that.
I was told that this thing that we're doing right now is like a preliminary discussion of the topics for the upcoming Astana Economic Forum. What do
Okay.
you know?
No.
Okay. Basically,
I did.
the idea, basically, Astana Economic Forum has been established for many years now. It's an annual event. It's a huge event. It's organized by the president of the country, and they
Okay.
provide global experts, mainly focusing on improving economic well-being of the region, of the country, of the world. And so they exchange ideas. And when
Hmm.
they talk about economic growth, it usually spreads further to education. And now they decided to have a panel on healthcare. Uh, and
Hmm.
so this year, first time we're having our own healthcare panel with a focused topic, which is introducing universal health insurance system in Kazakhstan, which is launched this year.
Okay.
And
Okay.
this second subtopic is quality of healthcare, value-based payment, quality of care,
Hmm.
uh,
Yeah, yeah.
and um,
Yeah.
and so I think today this is like an online discussion, which is a mandatory requirement that before people come and speak at the actual event, they have some online discussions. I
Okay.
thought it was going to be like a chat, but I write an idea and we discuss professionally a topic. I didn't know this is like a video
Oh,
with
I know. That's what I thought.
interesting.
Well, anyway, so there's Dr. Artman.
Yeah, I'm
Is
not
also
sure.
joining us or not?
Yes, do you know him? Do you know him?
No, I don't know him. Never met
Okay.
him.
Yes,
So, but I
Dr.
just saw his name.
Yeah, he's coming. I'm going to forward you his bio, official public bio, so that
Okay.
yes, he married a Kazakh woman, and he works and lives with his wife in Canada. He's a PhD in
Hmm.
epidemiology, and
Okay. That's right.
so he works for the government of Canada in public health or epidemiology area. Um, and so I was
Hmm.
told I got his CV from someone and I was suggested that maybe he can work for our organization as an advisor or whoever. So I've never met him, but he's coming to Astana for this event. So we will meet, all of us will
Okay.
meet. And so Professor Asaf, for
Well,
this forum,
okay.
let me just brief you a little bit. The Minister of Health will be attending this healthcare panel session on Thursday next week before lunch. It's first half day. President of Nazarbayev University will be there. There will be many other speakers invited internationally. And as I said, the running theme will be universal health insurance system. And
Okay.
within that, I think you're giving a speech on value-based healthcare. Basically,
Yes.
here we want to maybe discuss in the new system that Kazakhstan is moving to, which is a new payment system, moving from budget actual expenses reimbursement to health insurance system where citizens become a player spending money out of their annual salaries to the general national health insurance fund, which in the past there was no such a scheme. It used to be just the government reimbursement for Kazakh citizens. So now with the new scheme, I see blank spots. I see areas that have not yet been discussed in public. There's no decision yet and vision. It's blurred, it's unclear, which is quality control under universal health system. I mean, who will control the quality of individual cases?
Yeah, that's very important.
And I know that maybe
very
you can
important.
elaborate on that on your official speech. Like, what should health insurance fund do? Because as far as I know, in the US, private health insurance funds hire their own case managers who review individual clinical cases, who are clinicians, doctors, or maybe nurses, who review based on certain set standards, whether this or that case has been provided with so-called, let's say, quality, a level of compliance to a certain government. And if it's out of compliance, they may not even reimburse. And so is this already called value-based healthcare? What else is added into the term understanding of the word value-based? Can you hear me well?
Yes, I can hear you.
Okay,
I can hear you.
So yeah, so in fact, this even our current system has this element. The existing system, which is not called health insurance, it's called Minister of Health Committee for Payment. They have 16 regional offices. They pay for local services in the local region, and they hire people who review cases and who see a readmission of a patient or complication such as infection or whatever other prolonged, unusual, suspicious stay. They just cut payment for that case. They either don't pay at all or they cut it. So we in Kazakhstan, we do have some form of value-based, I think it's called value-based, I don't know, where there is some form of quality control where they tie money to quality.
Yeah.
However, I think the term value-based is broader, deeper, and the audience needs more introduction in this. And I think US is a pioneer in that, with too many examples of it.
Yeah, I know. Yeah, I can talk about a little bit about that, because we have, our system is a little bit more sophisticated. It's not general people can make the decision about acceptance or denial of insurance. They use a software. There are two different software that most organizations use.
Tell the country that there are software comes out there in the world that do this and that, because
when the person enters the signs and symptoms, enters the information about the patient, and the software will tell you what is the average length of stay for that patient, what kind of resources need to be used for that patient, and if there is a module that is more financial, it will the average cost for stay of that patient per day. So that's how they use it to accept or deny insurance payments. Okay, so they use the software even at the level at the time of admission to the hospital, and even at the time of accessing high cost tests, like let's say an MRI or venipuncture or something like that. So the software has to be used to tell whether this patient this activity or this intervention, is it necessary? Is it appropriate for this patient? So they use that software for two reasons: one for the admission,
Right.
and
So
one
I
for
see.
the what do you call it? The processing of payment. I can hear somebody else. I don't know if somebody
Yes,
else has joined us or not.
Hello, this is
right.
Mr. Al.
Yes, hi. This is Al Artman. Good morning, good afternoon.
Hello,
Hi,
can you?
Al. This is Al. This is Al Asaf.
Yes, nice talking to you.
Yes.
Hello, this is Ainur from Astana.
Hello,
And I
Ainur. How are
think,
you
I don't know if
doing?
you can. Yes.
Hello,
We don't see your.
face. Are you Al? Do you have a camera there? I think there is an option to see each other. We don't see you.
Right, exactly. Frankly speaking, this I'm sorry for interruption. It's the first time I'm using Chrome. It's the first time I'm using Hangout. So I try to connect it, but I'll listen to your conversation. Please go ahead.
Mhm.
Okay, that's fine. Okay. Ainur, would you tell us just the general idea about this discussion, and maybe we can
So
chime
let
in.
me introduce you again. So Astana Economic Forum is an annual event organized maybe now for 10 years in a row. I'm not sure when it started first. It's been initiated by the president of Kazakhstan, who actually personally attends the Astana Economic Forum every year. It typically is hosted in May. This time it's done in June, but they bring best international global experts, usually focusing on economic growth in the region, in the country. So it's all about economic growth. However, this year we decided to have a separate section on healthcare, which is called healthcare panel round discussion, whatever, on which will be held next week on Thursday at the premises of newly opened Nazarbayev University in Astana, which will be attended by the president of this big brand famous university, and also it will be attended by the Minister of Health of Kazakhstan, Dr. Burtanov. And the main theme of the whole healthcare discussion will be around introducing our mandatory or universal health insurance system. So our country is moving in a transition right now. Since July 1st, all of us employees will start paying 1% of our salaries to this national, already created National Health Insurance Fund, a single national legal entity, a non-governmental, non-commercial legal entity. And starting January of next year, the fund will start reimbursing healthcare entities for services provided for those insured. And so this is a big change, big move. That's like the number one agenda in healthcare today for us. And so that's why they want to devote the whole discussion of all of these invited experts to health insurance and its all of the everything that comes with it. One of the subtopics of the discussion will be quality of care, where you, Professor Asaf, are speaking. And so, in quality of care, people want to hear about what is value-based payment, what's value-based healthcare, what are the examples of best practices in the U.S. or in the world on value-based payment. Who should, in our case, who do you think should be involved as stakeholders or key players in making sure that we're not just paying for services of whatever quality, but we're actually make healthcare organizations accountable for the quality of care, maybe making citizens equally accountable for their own personal care. So those kind of things.
Yeah,
So that's kind of the general theme.
yeah, sure. I'll do that.
Professor
And as
Al Arteman, are
yeah,
you online still?
Yes, I'm listening.
Oh, okay, good. So it will be the healthcare panel discussion will take place on Thursday for half day. It starts at 9 a.m. and ends at 1 p.m. And it will be attended, as I said, by the Minister of Health. And mostly, I think they want to hear more vivid discussions rather than listening to somebody else's presentation. And there will be a moderator. Actually, the moderator will be I think, Vice Minister of Health, Mr. Alex Tsoi. And also, what is important, it will be attended by our newly created National Health Insurance Fund. the CEO of the National Health Insurance Fund in Kazakhstan is a woman whose name is Elena Bakhmutova. She used to be, she's actually from financial economic background. She has nothing to do with healthcare. She used to be the vice minister of economy in the past.
Okay.
So she was in government service at high positions on economic matters, global economic matters. And now she's heading the fund. And basically, fund is a payment mechanism. So we're moving from budgetary system to health insurance system. And there are many, many blank spots in our current situation. Although everyone in healthcare is working hard on making sure all the necessary laws and regulations and acts and all of the Ministry of Health orders are written so that it's a smooth transition and it's actually workable. But I see a blank spot in quality of care. I haven't seen any draft regulation that would address changes or a new model of controlling quality in the new system. Because there, in the
Mhm.
current system, which is budgetary, there are examples of fraud where health organizations just show as they bill the current payer, which is the government and its 16 regional offices. They just bill it at maximum as they can. If they have a hip, for example, there's two options to treat a hip. One is a higher, more expensive, higher cost case, and one is a lower cost case. Hospital will bill at the highest maximum rate possible, and they will write the medical record in a fashion that will look like it's the most difficult case. So now we see a problem in our country of artificial, partially artificial increase of costs for highly specialized care, or what we call, more tertiary, more secondary rather than primary, where it's just in the financial interest of any healthcare entity today to do cardiac surgery or neurosurgery, and even within any specialty, there's there's basic option, complicated and more expensive option. They would bill for the more expensive option, and it looks like everyone's getting sicker and sicker every day. But we understand as a country that there are problems with accountability and quality control. So it would be nice to hear. And there are options for Kazakhstan, such as creating electronical support, I mean, technical IT support for processes so that the system is transparent, controllable.
Good.
So I'm not sure. I'm more familiar with the American system where I've studied for 4 years, but I have no idea about the Canadian. I'm sure Professor Arteman, you can maybe comment on that. You have a universal health insurance system, right, in Canada?
Right, exactly. Universal healthcare system. And I sent you a couple of articles. I don't know if you have the chance to share those articles with the audience next week before the talk starts. It's about one is both from global burden of disease,
Hmm.
and one is about measuring health-related sustainable development. The other one is healthcare access and quality
Sort
index.
of. Did you send that link to that website that I have
I
already?
sent both. You can download the PDF from the
Ah,
PubMed link. So I think these would be very good reading materials before the next week's talk. Dr. Alasaf, how can I call you? Is that okay? I call you by your first name?
Who? Excuse me. You're talking to me or to
I
Ainur?
said, how do you prefer I call you? Should I call you by
Oh,
your first
okay.
name?
Well, yeah, sure, absolutely. Asaf, that would be
As,
great.
excellent. Dr. Asaf, you speak Arabic as well, right?
Yes, I do. I do.
أنا أفهم اللغة العربية little
Oh,
bit.
that's wonderful.
That's right.
That's great.
I teach online in Dubai.
Oh my goodness, that's wonderful. Great.
Okay.
Great to know that. Yeah,
All
really
right. No
wonderful.
problem. No, but
Well, we'll have a
uh,
chance to meet in on Thursday in
excellent.
Astana, and
Excellent.
we can exchange notes then.
Excellent. Nice to meet you.
Nice to meet you too. Thank you very much. And of course, I don't know, you met Ainur, right?
no, we
Oh,
haven't.
Ms. Ainur, we have talked a number of times.
Okay. Okay. But not in person or not yet?
No, because Ainur is in Astana. I used to do some work with the School of Public Health in Almaty many years ago.
Okay, that's why. Very well.
And then, sure.
Yeah, yeah.
Mhm.
So I think I know my presentation will be primarily on the reimbursement of providers. So we'll be talking about that, and I will even digress a little bit and talk about reimbursement of all, not only physicians, but clinics and so on. If however, in
Yes, go ahead.
the discussion, if we can target certain areas that y'all may want to hear more about, as you said, maybe talk about the reimbursement of insurance claims, on how insurance claims are processed.
Mhm.
Would you assign the you call it quality control, we call it, and how would you assign the reimbursement of certain episodes of care, whether it's appropriate or not, whether it's necessary or not. So maybe we can also have some kind of discussion on that, because that will be very helpful to y'all as well.
Yes, I think that would be helpful. And as you said, maybe you
Good,
could use the
good.
role of IT and programs, technologies in making it easier for the government, for the insuring organization, which in our case it's the Single National Health Insurance Fund,
Yes.
and to coordinate all of the work with providers. And what are the
Yeah.
and also my question is, who should hire all these case managers? Where should they sit? Should they sit in-house inside the employees of the health insurance fund, or it should be part of the governmental function? Because that's a historic situation in Kazakhstan. The Minister of Health has branches in different regions, which used to be involved in the past into accreditation of healthcare entities, and now they're like out of that job, out of that business,
I know.
and they're like so-called quality control experts. They usually go and review
Well,
cases, quality of cases, if
yeah.
there's from patients.
Well, we in our situation, we have two different types of case managers. We have a case manager that is hired by the hospital itself, and there's case managers that are hired by the insurance company, and the government is not involved. So it's the insurance company, and the hospitals have their own case managers. A little bit different in terms of
Mm-hmm.
either one of the case managers. For the hospital case managers, their objective is to hospital and gain as much revenue as possible for the hospital.
Mm-hmm.
So of course for them is to play with the system to make sure that the patient doesn't overstay in the hospital. The hospital will not send for certain tests or investigation that are not going to be reimbursed. So they are basically looking after the budget of the hospital, and also making sure that the patient receive quality care. So that's their approach for the case managers of the hospital. However, the case managers for the their main objective is to cut costs on the insurance company. So their approach is totally is to make sure that whatever the hospital is doing is appropriate, and whatever the hospital is doing in terms of submitting a bill is necessary. So they act in two different settings, or two different uh, uh, phases. The first phase is before the application of the procedures, or before the admission to the hospital. So they call it pre-certification area, the pre-certification phase. So if a hospital want to get a patient to be admitted in that hospital, they have to get certified by the case manager of the insurance company before they can admit the patient.
Mm-hmm.
And similarly, if the hospital need to do a certain procedure, in surgical procedure or any interventional procedure, especially high cost procedure, they also have to get certified by the case managers. Once the patient is admitted in the hospital, the case manager of the insurance company has no dealing with the hospital. They will wait until the bill comes, and with the bill, their job is to make sure that the bill coincides with the different activities that happen to the patient, and to answer the question: was what was the care appropriate, and were the services provided necessary or not? So that's their main objective in that. And I wanted to mention that the case managers for the insurance company that's when they use certain software to help them in making those decisions.
Because right now,
yeah,
the health insurance fund of Kazakhstan is at its inception phase. They have just registered
Okay.
the entity. They have a handful of people working full time who are mostly financial people responsible for money, actuarial, whatever forecasts, not for quality. I mean, they have a department in their organization called quality control, which is usually headed by a woman with economic education, no healthcare background, no healthcare work experience. So I have no idea if they're going to do that.
Okay.
I recommend, because they're at the beginning phase of, if they hear the right guidance, maybe they'll structure their system right. Yes. So you can tell about the type of people, size of whatever unit they might have. Because I'm sure these case managers are not going to review every single case, but they're going to do some sampling. So, I mean, like how many, whatever, like what do you think?
Well, not really. The case managers in our system, they review every single case.
Oh, really? So just tell that, because we have too many assumptions, and maybe
that on top of the case managers, and that layer is the more or less the quality control layer over the risk managers, over the
case managers.
They use a random sample of cases to review to see if the case was done appropriately, if the reimbursement was done correctly, and that kind of thing. So that's another layer on top of that, and that layer is those people are of clinicians, so both types, and they go through a the cases were handled appropriately, and whether the services reimbursed were necessary or not. Okay, so that's a different. Now in the U.S., because it's a large country, so what we decided to do is we developed what we call peer review organizations, PROs, and the peer review organization, now they call them the quality improvement organizations, or QIOs now. The is that layer that I mentioned. Cases, not all cases, random cases, and their question on those cases: were the care provided appropriate, and were the services provided necessary or not? Care, and the people who fulfill the are a bunch of physicians and economists, primarily physicians, primary care physicians. Once the primary care physicians or this panel identify that there is a discrepancy, and it will be referred, that case will be referred to another panel, which is more a specialized panel. And that specialized panel, they will mirror the case with a specialist, similar specialist to the care provided. So let's say the care was about a neurosurgery, then they will refer that to a neurosurgeon. If the care was about pulmonology, they will refer to a pulmonologist. So that's the third layer of quality control. So that's what happened. And what we did, because, as I said, because it's a large system, so we have a QIO in every single state. So we have 50 QIOs, one in each state. And that's the job of the QIO, is to review cases on a random basis. Of course, that's part of their job. That's not the only job that they do. There are other activities that they do. So that's how we do it in our system. Okay, but really, it's very, very important is that y'all could automate the process as much as possible. So utilizing a predetermined system, a predetermined software, and where you enter your parameters that affect your system correctly, then the software will basically screen the cases first, and then the job of the case managers will be much easier, because already the computer will screen the case, and it will show flags. so the case managers will not make mistakes because the software has already all the related to the different cases. Okay, and there are two different types of two different software that we use, or two different companies that we use in the U.S. And one of them is called Interqual, and the other one is Milliman and Roberts software. Interqual, and the other one Milliman and Roberts. So if you want to look into those and see what they are, and what they do, hospitals subscribe to one of those. They don't own the software; they get licensed to use the software, and it's a licensing package. And what I would suggest probably in the long run for Kazakhstan is to either adopt one of those or develop your own, where it could be more related to your system, and it will be more customized to your system, and that will be much easier for the case managers to handle their jobs.
Okay, that sounds interesting, Professor Saf. I think they're not going to be interested in hearing the details of what kind of software companies, but it's good to hear
Sure.
about the existence of such things. And there will be a moderator who will probably give a chance to speak to most of the people to have more involvement of different participants. So I think,
Good.
I don't know, Professor Arteman, do you have anything to add? I mean, this discussion is going to be inclusive so that not just the presenters, but everyone is welcome. I mean, at next week on Thursday.
Right. I think this is a great technical discussion, and I just want to make sure that all sub things would be covered through that session. But I think we have enough time next week.
Yeah. In order to maybe the session begins, maybe we can come up with some questions that could be and then pass it on to the panel so that those topics are discussed, so that it's not going to be somebody will use one topic and forget about the other topic. So if you want a variety of topics to be discussed, or a certain topics to be discussed, so I would really encourage you to come up with a list of questions and given to the panel so that they can identify them, so that you won't lose time. Because I saw the schedule. The schedule is very tight. As you said, it's only 4 hours max, including breaks and stuff. And so the discussion is not going to be, and there are 3 sessions. So
they canceled the third session. They canceled the health IT part altogether. They just will have health insurance as part 1, and then a break, and then the quality of care, value-based care as part 2.
Yeah, exactly. So it will be tight. So I'm saying that maybe we can target it a little bit better.
Topics that we would like to be discussed. I think I'll make a list and give to the moderator. I will not present. They basically cut some of the local Kazakh speakers, so they want to give more room for discussion of the topics.
Okay, sounds good.
Okay, well, thanks for joining this online session.
Yes, thank you.
Yes, tiny suggestion.
It was good.
Yeah, we might
go ahead.
Tiny suggestion from my end. Quality and accessibility. I think, Dr. Asaf, I think you're mainly focused on quality piece, right?
Yes, I do.
Yes, I'm more focused on accessibility. And that's why I wanted that paper on healthcare access and quality index could be shared, if possible, before the meeting.
Professor Arteman, I think it's very important because Canada and Kazakhstan have many things in common in things like geographic spread of people and very scarce population per square kilometers living, and problems of access to rural healthcare, and also another area of commonality is single health insurance system, opposed to the United States, where each state is a different state with different legislation. I think Canada and Kazakhstan have many things in common in legislation approach to centrally governing, planning, and ruling and controlling. So I think it will be very interesting to hear from a perspective of another country, some of the best practices.
No problem.
And ways to overcome barriers such as access.
No problem. I know after this teleconference, can I have a one-to-one conversation with you about logistics of my trip?
Yes, I think so. Yes, maybe on a call or something.
On WhatsApp?
On WhatsApp, yes. Yes, let's call
All
it
right.
that.
How about 1 hour from now? Can I call you in 1 hour from now?
Yes, yes, sure.
Because I have to go to a teleconference with Europe in a couple of minutes, if you don't mind.
Yes, I will call you in 1 hour.
Excellent.
Okay, great. Thanks for joining, everyone.
Very good.
Nice talking to you,
Nader.
Dr.
Take
Asaf.
care. Nice talking to you
Shukran.
too. Thank you very much.
Have a nice,
Bye-bye.
safe trip. I do thank you. Thank you very much.
Bye-bye.
Okay,
Bye-bye.
bye.